The benefit of distraction, denoising camera-based physiological measurements using inverse attention. Convolutional attention networks are the current state-of-the-art for obtaining physiological signals from video. This is an example of an input video and the generated attention mask used to compute the physiological signal. In addition to providing accurate physiological estimates, the attention masks also show which regions of the video are clean and contribute to the signal. While the attention masks capture the regions with strong signals of interest, these regions may be affected by corruption, which is difficult to suppress. The regions ignored by the attention masks may not contain the signal of interest, but they may contain corruptions that are correlated with the corruptions in the attention regions. For example, as the person is moving their head, the hair and skin move together and they will have similar low-frequency corruptions caused by the motion, with the exception that the skin also contains the pulse signal. We create the inverse attention mask to find the regions which do not contain a strong signal and consequently contain some corruptions. We use these ignored regions to estimate the corruptions present in the video and train a model to suppress them. This is the architecture of our proposed denoising approach. We use a convolutional attention network to obtain an initial estimate of pulse or respiration, and an attention mask showing which regions contain the signal. We create an inverse attention mask to find the regions without the signal and element-wise multiply it by the video frames to obtain estimates of the corruptions. A long short-term memory network, LSTM, can learn to suppress the corruptions in the physiological signals, producing cleaner pulse and respiration signals. We denoise the corrupted physiological signals using the corruption estimate. We obtain cleaner signals which match the ground truth signals better. Our denoising approach is robust even in presence of these sudden and large motions and facial expressions. Our model, which was trained only on RGB videos, is able to generalize even to the more challenging near-infrared videos without any additional training. We compare the performance of our denoising approach to several state-of-the-art methods for measuring pulse signals from videos, including supervised and unsupervised methods. Our method significantly outperforms the state-of-the-art, obtaining up to 40% lower mean absolute error in heart rate estimation. And our model, which was only trained on RGB videos, can generalize to the more challenging near-infrared, obtaining 70% lower mean absolute error. We could not compare all methods in near-infrared because the other methods require multiple camera channels. Our method also outperforms the state-of-the-art methods in breathing rate estimation, obtaining up to 30% lower mean absolute error. The respiration signals estimated with our method are cleaner and match the ground truth signals better than the baseline. We can not only obtain more accurate heart rate and breathing rate estimates, but we can even recover very subtle waveform dynamics, such as this dichrotic notch, which is absent from the yellow baseline waveform. Obtaining waveforms with a correct shape is very hard with camera-based methods, but it is very important for many clinical applications, such as measuring blood pressure. We quantified how well our method matches the shape of the ground truth waveform by normalizing the waveforms and computing the mean absolute difference between the estimated and the ground truth waveforms. Our method performs better than the state-of-the-art convolutional attention network, especially when the head motion increases. But sometimes this denoising approach may fail if the attention masks are poor and do not segment the facial regions well. This happens when the test set is very different from the training set, for example, has subjects with different skin tone, different clothing, different background, or differently compressed videos. Our code is publicly available.